So welcome to the stream. This is a 101 primer. Everything you need to know about the Wuhan coronavirus. The death toll from the coronavirus now stands at 80 or 81, according to some different sources, with almost 2,800 cases confirmed across China. The country is initiating emergency procedures to try and rein in the pathogen's global spread. On Sunday, Chinese health authorities confirmed that the virus can actually be spread before any symptoms appear. That means that carriers of this virus may not realize they're even infected, and in so doing, they may transmit the virus to others. This makes the virus even more deadly and harder to contain. The virus has been identified in almost every Chinese province, and 15 cities with a combined population of over 57 million have been placed under full or partial lockdown. Wuhan province itself has been effectively quarantined, with all routes in and out of the city closed or highly regulated. The government announced that it's sending an additional 1,200 health workers to help the city's stretched hospital staff. Wuhan Mayor Zhu Xinhuan said on Sunday that the number of cases could rise by another 1,000. In the capital, Beijing, there are almost 70 cases confirmed, including the youngest case confirmed so far. China has extended the Lunar New Year holiday to February the 2nd to attempt to dissuade people from traveling and spreading the virus even further. Almost all mass celebrations for the festival have been cancelled, and authorities have urged people to avoid holding traditional large family gatherings. Shanghai's government said that on Monday that all businesses in the city should remain shut until February 9th. Schools have been suspended until February 17th, and the quarantine inspection for workers returning to the city have been strengthened. Only vital businesses, as deemed by the government, such as gas stations, pharmacies, and supermarkets, are allowed to remain open. This map shows the spread of the coronavirus in China, with the concentration being in Wuhan province, where the virus is thought to have originated near a fish market. The severity of this emerging crisis is evident by the response of the government. The Standing Committee of the Chinese Communist Party, which is the country's top political body, headed by President Xi Jinping, has taken direct control of operations linked to this epidemic. The Ministry of Finance and National Health Commission has allotted 60 billion yuan, which equates to $8.7 billion, in fighting the deadly coronavirus this year, the ministry said on Monday. Meanwhile, they have admitted that the government did not disclose information in a timely fashion, which could affect the global spread of this disease. Scientists confirmed on Sunday that the coronavirus can be infectious before people even show symptoms. The virus could show no symptoms for any time between 1 day and 14 days. During that time, an asymptomatic person is also infectious and could spread the coronavirus to others, which might make it difficult to stop the spread of this virus. Symptoms of the coronavirus include nasal congestion, headache, cough, sore throat, and a fever. According to the infectious disease expert and University of California, San Francisco Professor Charles Chu, at present the rate of development of the epidemic is accelerating. The virus has already spread to 12 other countries, including Thailand, Japan, South Korea, Taiwan, Vietnam, Singapore, Nepal, France, Australia, Malaysia, Canada, and the United States. Currently, there are no tests designated to detect this exact strain of coronavirus. Coronavirus technically, Coronavirus technically refers to a family of viruses that cause a number of respiratory infections, including the common cold. Current coronavirus tests the doctors use cannot detect the Wuhan strain of the coronavirus. Someone who gets a coronavirus could have minor symptoms and develop a flu or develop a more severe or life threatening condition like pneumonia. What are the symptoms of the new coronavirus? Coronaviruses are a family of viruses, as we've mentioned, and they're pretty common. They typically cause mild respiratory symptoms such as a cough or a runny nose. Some strains are more dangerous. For example, SARS, which infected more than 8,000 people and was responsible for 774 deaths during an outbreak that began in the early 2000s. MERS, another strain identified in around 2012 in the Middle East, is even more deadly, with around 34% of people infected with the virus dying, and that amounted to about also 800 cases at the time. The symptoms of this virus are fever, cough, some difficulty breathing. The symptoms appear to set in at some point between 2 days and 2 weeks after the person has been exposed to the virus. There are no specific treatments for the infection, as with other strains of the coronaviruses, such as the common cold. There is no treatment for the virus itself. Those with the virus are treated for the symptoms, for example, addressing the fever, addressing the sore throat, runny nose, cough, and so forth. The WHO told journalists this week that the agency is still working to pin down the source of this virus, but many of the first confirmed cases were in people who had visited a food market in Wuhan. The market, which sells farmed, live, and wild animals, has been since closed and disinfected. How contagious is the virus? It's too soon to know how quickly and easily the virus will spread. It is airborne, and we know it can be transmitted between people. The CDC has just published more information on the suspected cases in the United States. These are the states that have confirmed 2019 nCoV coronavirus strains. The first confirmed case was in a 31-year-old man in Seattle, followed by a 60-year-old woman in Illinois, Chicago. Cases in New Mexico and California have also been confirmed as of Monday morning. Of the overall people under investigation in the United States, 5 have tested positive, 32 have tested negative, and the result of 73 others are actually still pending. If you have any questions or would like me to look for any specific information on this stream, please let me know. More information about what we know about the coronavirus cases that are in the United States. The CDC maintains that the risk to Americans is low despite the impact in China, which is 2,700 people infected, 81 dead, and 56 million under quarantine or travel restrictions of some sort. Dr. Nancy Messonnier, director of the CDC's National Center for Immunization and Respiratory Diseases, says, "We need to be preparing as if this is a pandemic, but I continue to hope that it is not." The 5 patients who've been confirmed had all recently returned from Wuhan, the CDC said. The first confirmed coronavirus patient in the US was a man in his 30s, and he sought treatment at an urgent care center in the state after returning from Wuhan. The urgent care center sent his samples to the CDC, which confirmed that he did indeed have the coronavirus. Oh yeah, you heard me, but I didn't. I imagined. Would you have to? Just one. You have to. So the first confirmed coronavirus patient in the U.S. is a man in his 30s, and he sought urgent care treatment in Washington State in Seattle after returning from Wuhan. After the urgent care center sent his samples to the CDC, he entered isolated care at a hospital in Everett, which is about 30 miles north of Seattle. He is receiving treatment in an isolated gurney designed for patients with highly contagious diseases, and a robot takes his vitals. This is obviously a great progress in the kind of technology that we have for helping us deal with patients that might pose a greater risk to healthcare professionals. Dr. George Diaz, who is the man's physician and an infectious disease expert, says that the man is in stable condition. He will undergo additional testing until he is no longer contagious. As we've mentioned, there is no specific cure for this, just like with the common cold and either flus and other viruses that are in the similar category. All they can do is help with the current symptoms and treat the symptoms such as fever, cough, runny nose, and any pain associated. So we hope that the man is in the best care possible. The second case confirmed in the United States is in Chicago, Illinois. A woman who is in her 60s was diagnosed a few days after returning from Wuhan province on January 13th. She is in stable condition and is reported to be doing well after undergoing treatment. This is coming from the Chicago Department of Public Health Commissioner Dr. Allison Arwardy. She will also stay in the hospital to control the infection. The next case that is known in the United States is in Los Angeles County, California. Details are sparse about this particular patient. We know that the patient is currently treated at a local hospital. Although the LA County Department of Public Health did not disclose to reporters how long they sought treatment after exposure to the virus. The department, however, said that the risk to LA County is low. In neighboring Orange County, California, a man in his 50s flew into the LA International Airport from Wuhan earlier this month. The county found out on January 23rd, and the CDC confirmed his results on Saturday. He is in a local hospital. The fifth known case in the United States is in Arizona. The state health department confirmed that this patient is an adult member of the Arizona State University community, although it did not release details about the patient's age or gender. The patient called their healthcare provider when they began to experience mild respiratory symptoms. The CDC confirmed the coronavirus on Sunday. The patient is not hospitalized but is self isolated at home, the department said. As we mentioned, there's no particular treatment for this virus, just like with the flu, the common cold, and other similar viruses. So the patient being self-isolated at home, as long as they're isolated and are not at risk of spreading it to other people, that might be as effective a quarantine method. Who is still at risk? The CDC is monitoring at least 100 other people in 26 states across the country for coronaviruses. They've already tested about 25 of them and they were found not to have it. Washington state health officials are monitoring 50 people who came in close contact with the state's patient, the first confirmed case in the United States. New York Governor Andrew Cuomo confirmed that the state has not seen any confirmed cases yet, but the state has sent 7 possible cases to the CDC for testing. Of those, 4 people are in isolation while the results are pending. The travelers had just returned to the US from Lunar New Year celebrations in China. There's another suspected case in Waco, Texas, where a student at Baylor is in isolated care. The university said the student is doing well with minimal symptoms, although the CDC has not confirmed the results of the lab test for the particular coronavirus. What's being done? The CDC is screening travelers from Wuhan at several US airports, including LA, San Francisco, JFK, Atlanta, and O'Hare in Chicago. These all began screenings within the last week. The CDC advises Americans to avoid unnecessary travel to Hubei province. 3 dozen US diplomats and their families in Wuhan will evacuate the region to return to the US early this week. Otherwise, it is encouraged for people to follow flu season protocol, washing hands with soap and water for at least 20 seconds, avoid ill people, and stay home and avoid public situations if at all possible. There is no coronavirus vaccine, and such a vaccine would take at least a year to reach the public. The new coronavirus. We're here talking about all that we can gather about the new late 2019 strain of the coronavirus that broke out first in Wuhan, China. Reports of infected people swiftly rose, and as of Monday morning, the confirmed cases across the world was 2,800, with 81 deaths having occurred in China. You may be wondering how worried you should be. Here's a primer on what we know and what we don't know about this virus and what it might mean for you and your family. What is a coronavirus? Coronaviruses are an extremely common cause of cold and other upper respiratory infections. These viruses are zoonoses. That means they can infect certain animals and spread from one animal to another. A coronavirus can potentially spread to humans, particularly if certain mutations in the virus occur, and this is what seems to have happened with this particular strain of coronavirus. In late December 2019, Chinese health authorities reported a group of cases of viral pneumonia to the WHO. Many of the ill people had contact with a seafood and animal market in Wuhan, a large city in eastern China close to Beijing. It has since become clear that this virus has now mutated to a point where it can spread from person to person. What are the symptoms? The symptoms are very similar to the symptoms of the common cold. Symptoms include cough, possibly fever, shortness of breath, sore throat, running nose. There are some early reports of non respiratory symptoms, for example, nausea, vomiting, diarrhea. Many people recover within a few days, just like with other forms of respiratory viral infections. There is no known cure for the virus, as there is no known cure for the flu or the common cold or rhinovirus. However, some people, especially the very young, the elderly, or people who have a weakened immune system, may develop a more serious infection such as bronchitis or pneumonia. And this may be the cause of the death toll, which in some cases in the past has been as high as 30% of those infected, as with the Middle Eastern MERS, which is a strain of coronavirus. How is it treated? Currently, scientists are working very hard to understand this virus, and the Chinese health authorities have posted the full genome in international databases. Currently, there are no approved antivirals for this particular coronavirus, so treatment is supportive. That means treatment focuses on relieving the symptoms associated with the virus rather than treating the virus itself. For example, healthcare professionals may focus on relieving any pain, fever, runny nose, cough, and so forth. For the sickest patients who have this illness, specialized aggressive care in an ICU can be life saving, especially as you mentioned for those who are compromised in their immune system, very young, and very elderly. So, should you worry? Yes and no. So, on the one hand, unless you've been in close contact with somebody who has the coronavirus, which right now typically means somebody from Wuhan, China, who actually has the virus, or somebody who's come from China recently, you're likely to be safe. This article specifically says that in the US, only 2 cases have been confirmed so far, but as of Monday, 11th a.m. Pacific time, there are actually 5 confirmed cases in the United States, in Illinois, in California, in Arizona, and in Washington State, Seattle. So this is still a very small fraction of the US population. However, you should be as worried as you are about any other virus. You should take the same precautions as you do during flu season. We don't understand the particulars of this strain of virus. Coronaviruses usually spread through droplets containing large particles that can only be suspended in the air for 3 to 6 feet before dissipating. So that is a cough, a sneeze. So you have to be in close contact with somebody who is infected with the virus. And remember that infection does not mean symptomatic, because in this particular disease, symptoms can come after the incubation period. Somebody could be very infectious but not show any symptoms yet. But either way, close contact is actually required to spread this. This is in contrast to diseases like measles or varicella, which is also known more commonly as chickenpox, where the disease can be airborne through much greater distances. Basic infectious disease principles are key to curbing the spread of this virus. Wash your hands regularly. This means at least 20 seconds of running your hands under water, vigorously scrubbing them with soap. Cover coughs and sneezes with your inner elbow. If you can, grab a surgical face mask and use that when you're going out into the world. They're actually sold out on Amazon. I went to check myself, and unfortunately a lot of the face masks were sold out, likely because of this. But you can make your own face mask at home. Just need like a little piece of cloth. The main thing, these are large particles of like small droplets of like liquid when you cough or you sneeze, so you can actually do a lot of prevention. You can do a lot of prevention by just covering your mouth, making a DIY at home face mask if you can't get one. I'm sure and the last Ebola infection, or the last in California with the wildfires with the smoke dust masks were sold out. So you can check at your local CVS, your Walgreens, your Rite Aid, or you can check on Amazon other sellers. But if they're sold out, remember, even a piece of cloth, a handkerchief, if anybody carries handkerchief nowadays, is better than nothing. Stay at home from work or school if at all possible. Certainly stay away from people who have obvious infections such as a runny nose, coughing, or sneezing. But just avoiding close contact with people altogether is the best bet. If you have the freedom or the ability to stay home from work, you should do so, or work remotely, you should do so. You should come straight home after work or school and just reduce your social calendar to avoid unnecessary contact with people, with the public, as much as possible. And even if the risk of contracting coronavirus in the US is quite low, the same preventative measures will actually help you avoid the influenza B, which is the flu, and any other similar rhinoviruses. Let's look at which other countries have confirmed cases of this new coronavirus. As we've discussed, it started in China, so a lot of the countries that are confirming cases of coronavirus are in Asia and are as a result of people traveling from Wuhan, China. Australia has 5 confirmed cases of the virus. The most recent was a 21-year-old woman who was in the last flight out of Wuhan to Sydney before China imposed a travel ban. Other cases have been detected in a man who arrived in Melbourne from China a week ago, and 3 men in Sydney who had recently arrived from China also tested positive from the disease and were in isolation in local hospitals. Cambodia has confirmed its first case of coronavirus on January 27th today, a Chinese national in the coastal city of Sihanoukville. 3 known cases in France, a 48-year-old man in hospital in Bordeaux. He had recently traveled to Wuhan. 2 others hospitalized in Paris, one of whom is a relative of one of the other infected patients in France. All 3 recently had traveled to China. In Japan, a 4th case was confirmed on January 26th, again from a resident from Wuhan who was visiting Japan for a holiday. Malaysia confirmed 4 cases, all from Chinese nationals on holiday from Wuhan, who arrived in the country from Singapore 2 days earlier. In Nepal, a 32-year-old man arriving from Wuhan tested positive for this deadly disease. Singapore, 4 cases, all individuals who arrived from Wuhan over the last week. South Korea, 4th case, 55-year-old South Korean man returning from Wuhan on January 20th, and similar cases. Taiwan, 3 cases so far. Thailand, 8 cases so far. In good news that we have not seen from a lot of corners, Health Minister Anutin Charnvirakul said on January 26th that 3 of the people who were infected were being treated while 5 had already recovered and gone home. As we mentioned, the US, cases in 4 states, with the states involved being California, 1 in LA County, 1 in Orange County, 1 in Arizona, 1 in Chicago, and 1 in Washington State in Seattle. Vietnam, 2 confirmed cases. An infected man from Wuhan traveled to Ho Chi Minh City earlier this month and also passed the virus on to his son. Both are being treated and are in hospital in stable condition. Again, this is a serious disease. It's a very serious disease happening in China. If you are in the United States, as are most people who are probably watching this stream, the chance of you getting this is low. But how you can avoid it is taking all the same precautions that you would during flu season. Washing your hands thoroughly, that means 15 seconds underwater, scrubbing your hands with soap, avoiding public situations as much as possible, reduce the social calendar, come back home at the end of the workday or school day. If you are able to stay home from work or school, and just avoid situations where you might be in contact with people who are infected with the coronavirus or really any other respiratory viruses such as the flu or the rhinovirus, which is the common cold. If you look at the history of coronaviruses, the most recent cases of coronaviruses were SARS and MERS. SARS was the severe acute respiratory syndrome that had a big outbreak in 2003, early 2000s. So in 2003, following the outbreak of SARS in the prior year in Asia, the World Health Organization issued a press release showing that a novel coronavirus identified by a number of labs was the causative agent for SARS. That virus was officially named the SARS coronavirus. Over 80,000 people in that case were infected, about 10% of whom died. That means there are about 800 deaths that were caused in 2002, 2003, known as attributed to SARS. So the almost 800, 774 deaths reported in 17 countries. Again, majority of cases were in China, mainland, and Hong Kong. And we've not seen any more outbreak of SARS worldwide since 2004. Research has continued on this virus and the entire family of coronaviruses, and Chinese scientists traced the virus through the intermediary of civets to cave-dwelling horseshoe bats. So it's a disease that is known to originate in animals, but it can jump to humans, especially after a mutation. So let's see how that went and see if it has any lessons for us today. So at that time, China had 5,000 cases and 349 deaths. If you include Hong Kong and Taiwan, then that means there are about almost 7,000 cases. And Hong Kong had a lot of deaths, unfortunately. There were about 600 deaths at the time. So if you compare that to what is known so far as of Monday, January 27th, we have about a third of the numbers. We have about 28 confirmed cases and 81 deaths. So if you extrapolate based on what happened in 2003, these are the numbers that we might be seeing in the near future, unless we are able to contain this in a much better way, and we have hopefully learned some lessons that we can implement in curbing this disease. In the United States, in that time, we saw 27 cases of SARS with 0 confirmed death, thankfully. As I've mentioned, right now, as of Monday, January 27th, we have 5 confirmed cases in the United States, and this is contrasted to 27 from that period. let's look at MERS, which is the Middle East Respiratory Syndrome, which happened a little bit more recently, although it was 7 years ago in September 2012. And the World Health Organization issued a global alert on this. Their update on 28th of September 2012 stated that the virus did not seem to easily pass from person to person. But in 12th May 2013, a case of human to human transmission in France was confirmed in the French Ministry of Social Affairs and Health. By 30th of October 2013, there were 124 cases and 52 deaths in Saudi Arabia. The Middle East Respiratory Syndrome was a lot more deadly than SARS. Just about 2,000 cases were reported as of 4th April 2017, and unfortunately, about 36% of those who were diagnosed with MERS did die from it. The overall risk of death might be lower because those with mild symptoms may be undiagnosed. As we've mentioned, the coronavirus family, the symptoms do look like the common cold or the flu. Upon further research, a strain of MERS-CoV was found in the first infected person in London was found to have a match with Egyptian tomb bats. That is also similar to the origins that was later discovered by Chinese scientists in the SARS case. So these do originate in animals but do jump to humans based on mutations in the proteins of the viruses. Again, as of 2020, there is no vaccine or treatment for this disease. A lot of antiviral medications are being studied. As with the virus we're looking at now, the 2019 strain of coronavirus, there is no vaccine, and a vaccine would take about a year to reach the public if work were to start on it right now. This is the current Wikipedia article on this developing story, so a lot of things might be in flux, but I'll try my best to summarize the issue and talk about what's happening here. This new coronavirus was identified in Wuhan, Hubei province in China, after people developed pneumonia without a clear cause, and for which existing vaccines or treatments did not prove to be effective. This strain of virus has shown evidence of human-to-human transmission, and in mid-January to late January, which is now, the transmission rate, which is the rate of infection, appeared to escalate, with up to 11 countries other than China reporting cases. The incubation time can be between 2 to 14 days, which is the time from exposure to the virus to developing visible symptoms. That is 2 to 14 days, and even during this time, it is still contagious. So carriers of this virus during this time may be asymptomatic. They may not be showing any symptoms at all, but they can still spread this dangerous virus. Symptoms do include fever, coughing, breathing difficulties, and other symptoms common to other respiratory diseases, and it can be fatal if untreated. The response in China has been widespread. Wuhan was placed under quarantine on January 23rd. All public transport in and out has been suspended, and in at least 15 other cities in the same province have been quarantined with travel bans implemented in a similar fashion. This has happened quite close to the Lunar New Year, and many mass celebrations, outside celebrations, public celebrations were actually cancelled or closed for fear of transmission. Hong Kong raised the infectious disease response level to the highest level possible and did declare an emergency. They have closed their schools until mid February and cancelled their the Lunar New Year celebrations. A number of countries have put out travel advisories warning against travel to Wuhan and or Hubei province. So, of all the 12 countries that have identified confirmed cases, a huge majority, if not all of them, have been associated with people who have traveled from Wuhan. This has been in many Asian countries like South Korea, Cambodia, Vietnam, Thailand, Malaysia, as well as other countries around the world such as the United States, France, Australia. Chinese scientists have been able to isolate a strain of the new virus quickly, and they did sequence the genome and made the genome sequence available for labs across the world to independently develop tests, PCR tests that can confirm infection in a person. Extensive testing in mid to late January confirmed over 2,800 cases in China. By January 26th, the death toll stood at more than 80, all in China so far. There have not been any confirmed deaths due to this in countries other than China. It is unclear whether this virus is of the same severity or lethality as SARS. This genome sequence is 75 to 80% identical to SARS and more than 85% similar to several bat coronaviruses. But again, the lethality or severity of this to SARS or MERS or other diseases has not yet been established. So this is me signing out. Please let me know if you have other questions on the coronaviruses and I'll try to do some research and answer them. But remember that the best thing that you can do is treat it like you would do flu season with just 10 times more diligence. As we've mentioned, there are 5 confirmed cases in the United States, in Washington State, in California, in Arizona, in Illinois. So this is something that can be present in the United States, although there are no confirmed deaths and not more than 5 as of Monday morning. So make sure you wash your hands very diligently or use an alcohol-based hand sanitizer. Go to Amazon.com or go to your local CVS or Walgreens or Rite Aid and just buy face masks or surgical face masks, the disposable kind, if they're there. If they're not there, you can actually make one at home. The most important thing is to just cover your mouth, cover your nose and mouth, so that the airborne transmission is not effective. We've learned that it is transmitted airborne through droplets that are present in spit and other bodily fluids when you sneeze or cough. So covering your mouth is effective for both those who are carriers and those who are at risk of being infected, especially if you're for minors, for the elderly, for those who have severe compromised immune systems. Just take care, stay safe out there, take all precautions necessary, and just stay home as much as you can. Avoid public situations, reduce your social calendar, go home straight from work or school, and just keep safe and stay safe this season. Thanks again, and I'll see you next time.